Imagine if healthcare was built specifically for you. Just imagine how extraordinary that world would be. You don't have to imagine. Maven is building healthcare for you. Because at Maven, we believe everyone deserves access to high-quality healthcare.
Hear in their own words why they should win.
Hi, I'm Kay Ryder. I'm the founder and CEO of Maven. I started Maven in 2014 because there were so many gaps in care along the deeply personal family journeys that we all have. I now have 3 kids that I've had on the Maven platform. And today, 8 years later, we work with, as a business, nearly half of the Fortune 15, and we cover nearly 15 million lives to help people through the fertility and family building journey, the pregnancy journey, parenting, and beyond. The secret to our success, that's the question here, I think boils down to one word: it's access. And so, that was really why we started in the first place. And access to us means a lot of different things. It means access to care when you need it, whether it be the weekend or the middle of the night. It means access to care at the right time with somebody that you trust. It means access to appropriate care. It means access to care from somebody that shares your lived experience, and that access to different types of care. And so I also have an incredible partner that helps design some of this access to care in Neil. So I'm going to turn it over to him as well. Do you want to share a few words?
Yeah, sure. We believe that the well-being of mothers is a bellwether for the well-being of society as a whole. And that's why every injustice in society shows up in the well-being of moms, whether it's inequity of race or gender or geography. And I'm just thrilled to be at Maven because we can use digital health to correct some of those inequities by providing access, as Kate says.
They told me I'd follow in my mother's footsteps. She died young from diabetes. That terrified me.
I was in constant pain, especially in my feet. I didn't know if I was going to be able to carry on doing my job with the pain that I was suffering from.
I was diagnosed at 27 with diabetes, and shortly after that I was put on insulin. For me, that was scary.
They tell us all these things about what living with diabetes is all about.
What living with diabetes means.
But they're not true.
My job is to provide benefits and save the company money. I now have a life-changing solution for our employees and their families.
I'm not on insulin anymore, and it's a very big deal. Can't wait to see what's next.
I'm better at my job than I was 10 years ago. I don't deal with the constant pain, and I'm putting the young guys to shame.
I've heard people say opioids are addictive, but I didn't understand what that really meant. Some days, I don't even recognize myself.
Most nights I fell into the same routine. I drank late and woke up feeling terrible.
I know I need to stop. I can't do things I love, and that scares me.
Millions of people suffer in silence with addiction, costing employers over $81 billion annually. Quit Genius is the world's first digital clinic dedicated to helping people conquer their substance addictions. We are the only clinically proven telemedicine program to virtually deliver medication-assisted treatment for multiple addictions. Members can work through highly personalized cognitive behavioral therapy on their own time. Adherence and outcomes are measured through a set of remote monitoring devices, while certified counselors and coaches guide members through every step of their journey. Quit Genius, helping our members be the best versions of themselves.
Hear in their own words why they should win.
Quit Genius created and dominates the category for integrated substance use care. We're recognized as the world's first digital clinic for treating nicotine, alcohol, and opioid addictions, and now provide the most innovative and effective treatment program in the nation. This unique program is built on the evidence-based principles of medication-assisted treatment, and it combines behavioral therapy with FDA-approved medication with industry-leading outcomes. Our program follows guidelines utilizing cognitive behavioral therapy as part of a holistic approach to combat addiction in the workplace. Now, this helps improve the lives of members by empowering them to conquer their addiction and regain control of their lives. We deliver comprehensive care, starting with 24/7 access to drug and alcohol counselors, quit coaches, and prescribers via telehealth and text, supported by our on-demand app-based program. Our program is built on a decades-long foundation of scientific research and supported by ongoing studies. And providing the best care for our members is paramount, which is why we've invested heavily in clinical research, now with 9 peer-reviewed studies, including a randomized controlled trial that makes Quit Genius the most validated digital addiction program on the market. 40 million Americans have a substance use disorder, yet fewer than 10% of them get access to the help that they need. Quit Genius is highly deserving of the UCSF Health Award because of our world-first solution. We are addressing this national crisis and demand for effective solutions by solving the challenges of access, cost, and efficacy. And we've already helped over 750,000 people improve their lives and quit their addictions. But we're just getting started. Our mission is to help 100 million more.
The Capital RX member app offers a modern healthcare experience for our members. Through advanced technology, we remove barriers to care and connect users to their pharmacy benefits information from anywhere. All technology at Capital RX is created to be as simple and easy to use as possible, and the member app is no different. Our proprietary technology allows us to seamlessly integrate with Judy, our enterprise pharmacy platform. This offers members access to details like real-time accumulation totals, updated claims history, and test claim information on the spot. On the home screen, members can view deductible, out-of-pocket, and plan spend information immediately after logging in, and a click of a button offers an explanation of what each section means for them. Toggling between individual and family plans is simple, giving members the ability to make decisions for themselves and their families from one central location. A digital pharmacy card is also conveniently located on the home screen, so members can share it with their pharmacist on the go at any time.
Hear in their own words why they should win.
Our mission is to change the way drugs are priced and patients are serviced to create enduring social change, because every American will fill hundreds of prescriptions over the course of their life. To reduce prescription costs in the United States, it required 2 initiatives from our organization. The first was to create a public ledger for prescription transactions. We call this a clearinghouse model, where we allow the buy side, the employer and patient, and the sell side, the pharmacies, to freely communicate on price. We do this with a flat administrative fee, and we do not encumber prescription prices. This means every patient and plan receives the same price, but more importantly, we deliver it through an agnostic network of pharmacies. So retail, mail, pharmacies across the United States, including health systems, can freely participate in our network model. We deliver this model through a modern administrative platform. We call this Judy. Judy is short for adjudication, and she's the brains behind our organization. The systems of the United States that are running prescription transactions are 20 to 30 years old and have traditionally only addressed the thin middle layer of processing claims. Judy is a true enterprise health platform and contemplates every workflow a pharmacy benefit administrator must contemplate, from underwriting to plan setup to claim processing to drug utilization review, clinical workflows, as well as network administration, billing, and reimbursement. By doing this, we're able to reduce costs for our customers by over 80% on the administrative side, and this means lower cost prescriptions for the patients in the plans. The results of Judy speak for themselves. We are the fastest growing PBM and healthcare company in the United States. We manage over 1.4 million lives with 150% year-over-year growth. We have a net promoter score of 96 on the client side compared to 14 net promoter score for the industry. We have a net promoter score of 68 in the call center for our patient compared to 7 net promoter score in the industry. We couldn't achieve these results for Judy, and we are truly achieving our mission to change the way drugs are priced and patients are serviced to create enduring social change. Thank you.
hear in their own words why they should win.
Hi, I'm Rafael, and together with my brother and co-founder Rodrigo and the support of our team, we are building a new health model designed around patients' needs.
This model delivers low-cost, high-quality care focusing on prevention and health promotion. We use AI and data analytics that allows us to identify patients at risk and create long-term relations with them.
We have learned quite a lot from our clients and patients over the last year and are bringing all those learnings to our product now, which has been used by more than 20,000 people just in 2021.
In this way, we're building a reliable one-stop-shop platform for primary care, becoming the first option for our patients and their families.
Our care approach is based on aligning different stakeholders in the system, leveraging millions of data points that lead to efficiencies and savings, but above all, positively impacting the daily lives of millions of users by providing them care throughout time, anytime they need it, when.
My name is Thayer John Muhammad, and I'm the founder and CEO of Managing Life. It's an honor to be considered for the UCSF Awards. At Managing Life, we're tackling the chronic pain and opioid crisis head on. And it's a problem that affects employers across North America, as it's an extremely prevalent condition and a significant driver of both absenteeism and prescription drug use, such as opioids. Beyond that, it's also a leading cause of medical expenditures on health plan claims, as well as a leading cause for disability. Our solution, Manage My Pain, is a clinically validated digital solution that empowers people living with chronic pain and teaches them coping strategies. It starts off with our app, which is the top ranked and most downloaded pain app on the market. It's based on acceptance and commitment therapy principles. As people track and record their pain, we play back that information through charts and graphs to highlight patterns and trends. We also then share them educational content that teaches them coping strategies rooted in the best practices of pain psychology. That information is then translated into reports that they can then share with their care team. And finally, all this information can be seen remotely and digitally through our monitoring portal at the aggregate, at the population level, or down to the individual. Now, what makes our solution truly unique is that it works. In March of last year, the University Health Network announced a publication of our multi-site validation study that showed that our solution had resulted in improved outcomes, both from an anxiety and pain catastrophizing perspective. It makes ours the world's first and only digital solution with clinical validation. At RBC Insurance, people who used our solution on disability had a 7.5-month shorter claim duration. I'm excited to expand more on Managing Life and be considered for these awards. Thank you very much.
Hi, I'm Raja Sundaram. I'm the CEO of Plati. Thank you very much for giving us this opportunity to articulate our differentiation. The Plati Recoup differentiation is patient engagement, along with algorithms that track range of motion for all major joints. Our approach to injured worker engagement uses a biopsychosocial method, effectively leveraging Internet of Things and Internet of Behavior to drive quality outcomes at a lower cost. This includes easy to follow programs, easy to use technology, individualized analytics, together with experienced coaches who understand the injured worker's archetype and behavior. The Recoup program allows us to understand home situations, patient motivations, and behaviors. All of this provide our coaches with the necessary information that allows us to use empathy and understanding to find those personalized motivators. Once we adapt and fully understand the injured worker, the quicker we can retain motivation, engagement. All of this keeps them in track for a healthier, safer, and more cost-effective recovery. The Recoup program listens to the patient's body and mind by analyzing biometric data and current well-being along with the trajectory of recovery. Recoup continues to deliver high quality outcomes with high patient satisfaction. This reflects in our results day in and day out for our customers. Thank you again for the opportunity.
Purpose. It's what you find most important in life. It's what drives you to do your best and be your best. People with a strong sense of purpose are happier, live longer, sleep better, recover faster, and have a bigger impact on the people, organizations, and causes they care about. You can too with Purposeful. Purposeful is simple, but it's based on powerful science. Here's how it works. Purposeful thoughts have a powerful effect on us. They fuel the part of the brain that allows us to regulate emotion, manage stress, and make better decisions. Purposeful focuses and amplifies this effect to help you become your best self. With Purposeful, you'll reflect on what matters most, form new habits, and explore fresh ideas from our experts and the Purposeful community. Ready to build a better you? Let's get started.
Hear in their own words why they should win.
There are literally over 1,000 studies that have been done showing that people with a stronger purpose are more resilient. Only 16% of executives say that their wellness strategy is delivering. We believe that employers need a new approach. The Kumanu solution builds a stronger culture of well-being by addressing personal, organizational, and social determinants of health. Kumanu's Purpose Cloud platform offers an out-of-the-ordinary well-being experience. Our AI-driven Purposeful app serves as a daily coach to help you build your purpose muscle. We deliver localized resources to address social determinants, and we wrap in live ways to get involved, like workshops and purpose casts. Purpose is Kumanu's superpower. Hundreds of peer-reviewed studies on the impact of purpose have called for an intervention to boost it. That's what we've built. A sense of purpose boosts resilience, promotes inclusion, and lowers mental and physical health risks. It's the factor that's gone largely unaddressed for decades. Until now. We think Kumanu should win the Employer Prevention and Wellness Award because we're the only employer well-being platform that challenges the status quo, not just in words, but in action. Traditional wellness is based on fixing and incentivizing employees while ignoring intrinsic, organizational, and social factors. If organizations want healthier workforces, they need to invest in the heart of the matter to get to the root causes with purpose. If purpose were a pill, this would be a really important drug.
Approach different? We look at your genetic makeup, gut microbiome, gender, ethnicity, clinical symptoms, and lifestyle habits to be able to provide you with food as medicine recommendations. People who join our program are typically dealing with different health challenges. These can include digestive disorders such as irritable bowel syndrome, acid reflux, chronic constipation, or diarrhea. Other experience insulin and weight-related conditions like prediabetes, diabetes, or obesity. Chronic pain, skin conditions, and mental health challenges are also common among our members. That's because so many of these conditions are connected to your gut. You're currently in the first phase of your journey. Once you have completed the tasks in the app, we're excited that you're here and look forward to cheering you on as you're on your way to living a disease-free life.
Hear in their own words why they should win.
We are focused on 80 million Americans who struggle with digestive and associated cardiometabolic illnesses, and we deliver care that's unique to your biology, their biology, and their lifestyle circumstances. Digestive health and associated cardiometabolic illnesses is one of the fastest growing cost categories for employers and payers because the current care approach is fraught with misdiagnosis, fragmented care, and huge amount of social and professional stigma. Over the last 3 years, we have built the trust and earned the business of leading employers and leading platform and benefits players in the healthcare industry. The reason why genetics and microbiome is important is if you look at these disease conditions, they vary significantly by gender and ancestry because the root cause of that is linked to genetics and microbiome. So we are advancing health equity and health innovation for employers and payers. Over the last 3 years, we have published numerous peer-reviewed studies that demonstrate the efficacy of our platform, 80% experience reduction in GI symptoms, almost 70% experience improvement in mental health symptoms through the gut-brain axis. We continue to deliver amazing results on cardiometabolic health associated with digestive health, and we are leading the innovation space as the only company with published studies and the ability to manage pharmaceuticals. Thank you.
LiveMetric is revolutionizing hypertension and cardiovascular care. LiveOne is an FDA-approved cuffless wearable band that measures blood pressure anywhere, anytime. Completely passive, it requires no calibration and uses a proprietary sensor array placed over the radial artery to produce a pressure waveform.
The LiveMetric wearable technology will change how hypertension and cardiovascular disease are managed and treated by allowing clinicians and patients to monitor blood pressure continuously 24/7 in a completely passive manner.
The beauty of the LiveMetric technology, actually, that is taken advantage of, is something you could never do with the cuff. And that is, it evaluates your blood pressure throughout the day. It does it in a way that is not cumbersome. You're not getting a cuff inflating periodically. It's not disrupting your sleep. It's really kind of uneventful.
Hi UCSF Digital Health Awards. I'm Kate McGinley and I'm a founder here at TuneCare. What is TuneCare? Well, we are reinventing what hearing health benefits mean, who has access to them, when care is delivered, and how. Our mission is to bring hearing care to everyone. In a world where headsets are work tools that we all wear for hours every day, employees need help to conserve their hearing health and treat issues that arise from this new environment, such as tinnitus. Led by the largest network of specialist audiologists, Tune delivers hearing care beyond hearing aids. We make it easy and affordable for companies to implement an equitable hearing benefits program for employees. The solution and audiology team supports care across an array of conditions, from conservation and preventative care to more complex conditions like tinnitus, auditory processing disorders, and pediatric care. I want to talk for a minute about the UCSF Digital Health Award and what it would mean for us to win. Today, commercial health plans only offer discounted hearing aids on employer plans, if anything. We know that 48 million people covered by these plans have hearing issues that cannot be treated by hearing aids. As you know, we want to bring hearing care to all, and we hope that by winning our UCSF Digital Health category, we can further the mission to bring these people the hearing care they deserve. We know employers look to you all for guidance, and we hope you'll help us bring care to the 48 million employees who deserve to keep their sense of hearing. Thank you.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.